And we're back talking about Canada's opioid epidemic. We're chatting with Adam Zivo. Adam, I wonder if we could switch gears a bit now and talk about safe supply. I mean, we hear this term all the time. Could you tell us what safe supply is and which provinces are using this approach known as safe supply?
So, Safe Supply is a program where the government gives addicts free pharmaceutical drugs as an alternative to potentially tainted illicit substances. So, let's say, for example, Colin, you get really stressed from hosting the show and you develop a fentanyl addiction. And when you're buying fentanyl
Right.
on the street, you don't know what's in it. You don't know if it's tainted with xylazine or benzodiazepines, which can kill you or cause necrosis. You don't know what the dosing is, so you may accidentally take much more than you were expecting, which causes you to overdose and die. So the idea is that, okay, well, we'll just give you a safer supply of pharmaceutical drugs from the government, which will keep you alive until you're ready to seek treatment. And that sounds really nice in theory, but in practice, it's much messier and much less effective than some people think.
And there's people that are obviously pro safe supply. We tried to actually invite a few to come on the show. We couldn't get anyone, but there are people that are, say that this is saving lives. You've obviously been critical about it. What would be your major concerns with the safe supply approach?
Well, I mean, the primary one is the issue of diversion, and diversion refers to people reselling their drugs on the street. So the problem is that most hardcore addicts who are targeted by safer supply are using fentanyl. And as I mentioned earlier, fentanyl is about 10 to 50 times stronger than heroin. And we give out a drug known as hydromorphone, which is essentially pharmaceutical heroin. And that drug is incredibly powerful, but compared to fentanyl, it is like holding a candle to the sun. So drug users just generally don't want it. So what they'll do is that they'll sell it at dirt cheap prices, usually about 50 cents to $1 a pill, and then use that money to purchase illicit fentanyl off the street. So we're not actually mitigating the illicit fentanyl market, we're subsidizing it. And then those diverted drugs end up flooding into communities, causing the street price of hydromorphone to crash by up to 95%. Before Safer Supply used to cost, like, say, $20 for an 8 milligram pill of hydromorphone. Now it costs 50 cents to $1, maybe $3 to $5 if you're getting it down, like lower in the chain. People will resell it, resell it, resell it. And then that, of course, creates more addiction. And then because hardcore users don't want this hydromorphone, it disproportionately goes to opioid naive users, which means that it often goes to youth because youth
Hmm.
don't really know what it is. They know that they shouldn't use heroin. They don't want to inject heroin because intravenous drug use is intimidating. But if you give them a pill at a party and you tell them that it's safe, it's prescribed by the government, it's just a pain relief medication, they're likely to try it because they don't know that it is the equivalent of heroin. And then they get addicted, and then some of
Hmm.
them graduate onto fentanyl, which then kills them. So that is my concern there. The other concern is that these pills are not meant for intravenous use. Yet drug users often crush and inject the pills because that creates a better high. And in fact, many safer supply
Hmm.
programs condone this and actually give advice on how to do that. But because these pills are not meant for intravenous use, they're made with materials that don't fully dissolve in the blood. And so what they do is they pass through the bloodstream, they go through the heart, and they get lodged in small blood vessels located in the spine, which then leads to excruciating, debilitating, disfiguring infections, which safer supply patients are not warned about. And then on top of all of this, and all the other harms I described, is that safer supply seems to cause people to abandon recovery oriented treatments. I've heard dozens and dozens of stories of people abandoning methadone and Suboxone, which are treatments that actually work for safer supply because they'd rather get free opioids than get better. Or people who now find it harder to stay clean because the streets around them are flooded with really cheap, really available hydromorphone.
So how does it work? Let's go back to this example, and I hate to do it, to think about it, but I'm extremely stressed out about the show, and I get hooked to fentanyl, whatever. When I go into a safe supply place where they're offering this, how many pills are they actually giving to people?
Well, I mean, you can start with, let's say, 4 or 8, then you go up to 14. Oftentimes, people receive between 30 and 48 8 milligram pills. One 8 milligram pill is 4 times the dose used to treat post surgery pain. And just 2 or 3 of these pills is enough to induce an overdose in an opioid naive user. just one pill is enough to induce a fatal overdose if mixed with alcohol, because alcohol also depresses the system. So these pills are highly dangerous, and as many as 30 to 40 or 50 are sold on the street per patient a day.
Oh, those are some staggering numbers. When we come back, we'll talk more about safe supply.